focus on the good. Because if you focus on the positive things you want to include in your diet to make you healthier,
You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your private, helping you get in the know, down the low.
Hi friends, Dr. Susie G here, and welcome to another In Your Pants podcast. Today we're going to be talking about eating to fight pelvic pain. And to help me do this, I have special guest, Jason Stevens, who is a registered dietitian nutritionist. And on the show today, we're going to be talking about considerations for including an experienced registered dietitian nutritionist on your healthcare team. And individualized diet counseling may be part of your health journey. And so we're going to unpack when and if you should consult with a registered dietitian nutritionist. We then talk about mindful eating practices and tie in mindfulness into a strategy to reduce pelvic pain. And then we chat about foods that actually fight pelvic pain and what the research says around certain nutritional practices and diet practices that may help reduce pelvic pain. And then lastly, we touch base on antibiotics, proton pump inhibitors, and how these can impact your gut microbiome and what this does to your digestion and how this can influence pelvic pain. So, before we dive into the details of this episode, I'd like to formally introduce Jason to you. Jason is a registered dietitian nutritionist, completing his advanced practice residency through Rutgers University as the final part of his studies in the Doctorate of Clinical Nutrition program. In his 12 years as a dietitian, he has worked as a clinical oncology dietitian, taught clinical nutrition in an accredited educational program for dietetics students, and is currently a full-time college educator. His research interests include advanced level practice in the field of nutrition and dietetics, and the role of nutrition in pelvic pain. This is a really, really fun-packed show, so I hope you enjoy. Hi, Jason. Thank you so much for being on the show today.
Hi, Susie. Thank you so much for having me.
So let's dive right in. I am curious as to, just for our listeners, I've been working with you for some time together. We've been collaborating on care, which is such a wonderful opportunity. But for our listeners who may not know what the role of a registered dietitian nutritionist is, can you explain that for us and give us a little background?
Absolutely. I'm happy to do that. And I think what you'll find is a lot of folks in my profession feel eager to share what we do, because there is still a lot of misunderstanding about what the role of a registered dietitian nutritionist is and how that differs from a nutritionist, because that is sometimes what you'll hear. And even though that term is technically accurate, the word nutritionist has no legal definition. So a registered dietitian nutritionist, or RDN, has to meet certain professional requirements in order to practice or to have that credential. And so a registered dietitian nutritionist, really, even to get there, and we can kind of discuss what they do once they get there, but really to get that title, it requires a certain amount of education. So that's typically didactic coursework. It looks a lot like pre-med on the front end, anatomy, physiology, biochem, all of that good stuff, metabolism. And then with a lot of nutrition tacked on, and that's really anything from, the pathophysiology of disease and how nutrition sort of interacts with that, drug-nutrient interactions, medical nutrition therapy, but also we take, sort of like cooking classes on steroids. We learn like the science of food. I got to play around with different types of dough balls in the kitchen, so really the education of the registered dietitian nutritionist is really broad and diverse. And I think, not to brag on my I do want to brag on my profession a little bit.
Brag away, Jason. Brag away. You deserve to.
Thanks. That we're really well-rounded members of the healthcare team, I think, in terms of what our knowledge is. But also we get to talk about food for a living. So who doesn't want to do that? So that's sort of the didactic or educational piece. And just for our listeners' understanding, we're actually moving to a master's degree requirement by 2024 to become a registered dietitian nutritionist. So right now it's only an undergrad, but that is changing. And you'll see most educational programs have already made that shift. So then on top of that, we then have a number of supervised practice hours, which I'm going to get this wrong. I think it's around 1,200. supervised practice hours. So that is, under someone else's supervision. A lot of folks call that an internship. And then after that, passing a credentialing exam. And so then once you have that, you're a registered dietitian nutritionist. And then you keep up continuing education credits. So then the big puzzle is sort of, okay, what do we do now? So my specific focus is as a clinical dietitian, and dietitians do work in a wide, so talking about that broad experience, we work in a lot of different settings. So I'll miss something, and any dietitians listening out there, you're welcome to add it to the comments, but we work in a wide variety of settings, from education to business, private practice, community settings, to clinical settings. So we're not just in the hospital, we're everywhere.
Which is a good thing.
Yeah, I know, it's a good thing. Sorry, that sounded creepy, but no, it really is. It's a good thing, because nutrition is so important. And when we look at the context of nutrition and pelvic pain, which is it's an underserved area in healthcare, period.
Agreed.
And then nutrition, so when I went looking for dietitians who were doing this, there aren't any. If they're out there, please, shoot me a message. I'd love to know where you are, but it's just not an area that we're really involved in right now. So, but looking at how the RDN can be a part of the healthcare team is really the process of providing medical nutrition therapy as part of a patient's care. So that involves a thorough assessment of really hearing the patient's story. So, tell me what's going on with you, and really getting the full picture of what brings them to the table, so to speak. So what's going on with you? And that also includes like a head to toe physical assessment, looking for signs of nutritional deficiencies or excess. That also includes reviewing, medications, supplements that they're taking, looking for drug nutrient interactions. And we've, seen that already happening in our collaborative care. Then a thorough review of what they're eating and how that's contributing to what's going on with them. So looking at diet history, health history, so it's a complex picture. Lab work even too, looking at blood work and how nutrients are interplaying there. So once we have that big picture of a patient's story, and then working with them. So my big thing with being a clinical dietitian, and something that I think our profession is getting better at, is really working collaboratively with patients. So rather than a directive approach, which I think a lot of patients are sort of scared that that's what we're out to do. Like we're the food police. We're here like, no, you shouldn't have that donut. Like put that down. Like, no, it's really, this is a collaborative journey. Like I want to work with patients with what they're doing and figure out how we can find a way of eating that supports their health. That's also something that they're willing to do, comfortable with doing, fits their culture, their lifestyle, and really working together. And a lot of that's counseling.
Right. Which is so complementary to, my work as a pelvic therapist, physical therapist, and also beyond that, right? So you are an integral part of the healthcare team for wellness and well-being. And what I want to just summarize and unpack, because that was a lot for us to chew on, no pun intended. But that this isn't just a weekend course that you took, and
right.
and that you're like, okay, I'm an expert in nutrition, and now I'm going to tell you this new diet fad or nutritional fad or what have you. There's so much of that out there. No, these are registered dietitian nutritionists are folks that go through a very intensive curriculum to understand the impact of food as medicine, and also understand, as you so well put it, the from head to toe holistic approach to working as a collaborative care partner in their health goals, their health needs, etc. And so it's not just about, put me on a diet or tell me what not to eat. I mean, most of us know, we know. You don't need to have someone tell you
maybe we should, take pizza off the table for one day out of the week, like it's not about that. But as you're saying, Jason, it's really about this comprehensively educate. So a lot of education, a lot of counseling. And also I liked when you mentioned the supplements and medication management, because with pelvic pain, as we have collaborated together on patients' care, we have noticed the perhaps unnecessary, in most cases, unnecessary supplementation, and even to the degree of just making sure that we're being aware of medication side effects and medication influences on someone's digestive system and their pelvic and their pain. And so having that perspective from the registered dietitian nutritionist perspective, I think is so important and very often overlooked, as you mentioned earlier, that there aren't a lot of folks who are doing what you're doing as far as what we're doing complement in this collaborative way. And particularly when it comes to chronic pelvic pain syndrome in those who identify as male, right? Or are
Right.
penis havers, right?
Yeah. So I have an interesting story with that too. And I was talking to a nurse colleague of mine, just as an example of this, and was telling her about my residency experience, which is, again, such a unique, like innovative thing to be able to partner these two health professions together. I always say it's like peanut butter and jelly, like what we do complements each other so well. But when I said to her, yeah, I'm working with chronic pelvic pain, she says, oh, so you're seeing women with chronic pelvic pain. And she acknowledged when I told her, actually predominantly working with men. And she said, see, that shows my own bias about, you say pelvic pain and immediately I think it's cisgender women. So you hit the nail on the head there. And that's something I think is makes us an underserved population.
Absolutely. And you, like, again, this collaboration that we've had has been so helpful for, I would say 90% of the folks that I see are talking to you.
Yeah.
Right. I was like, no, I really think that we need to talk to Jason. And so, Jason, let's talk about some of the cases that you're seeing, or some of the diagnoses or issues that folks have that are perhaps tied into or overlap with pelvic pain, right?
Sure.
So what have you been noticing as we're working together? I just wanted to.
Yeah. That's such a great question, because I was reflecting on this earlier that, I came into this residency experience thinking a little one-dimensionally, and I knew better, because in clinical practice I always saw it's never just one thing, right? Like, I worked in oncology nutrition, but nobody just had cancer. It was like cancer and diabetes and chronic kidney disease and hypertension and, so the list goes on of like things that you can touch upon. So in our population, what we're seeing, we've caught like early cases like prediabetes. Like we had a patient that we were able to like identify that, and that's going to contribute to their pain and possibly to like sexual health difficulties, and there's an interplay there. Digestion for sure, so a lot of interplay with folks who have maybe been diagnosed with irritable bowel syndrome, either predominantly constipation or diarrhea or mix, functional constipation, dyssynergic defecation. That's always a tongue twister for me. Hyperlipidemia, high cholesterol. I just think there's so many things that when you start cracking open the walnut, no pun intended, like it's like, oh, it's a surprise. Like there's so much in here that we can influence with nutrition, and that the important thing is they're not isolated, right? So these conditions that I'm able to help patients with related to nutrition that they may think have nothing to do with their pain may have a lot to do with their pain, or maybe a significant driver or contributor to that. And it's never just one thing, but it's like, hey, sometimes just telling patients that, like, hey, did you know that this particular, like if we work on your metabolic syndrome, that may actually help with your erectile dysfunction. And it's like, oh, wait, now I'm really motivated. Right. I'm really motivated, right?
Yes, absolutely. And again, I know we're kind of bringing some lightheartedness to this topic, but and we get it, it's very distressing, when all these changes to our bodies start to happen and we start to lose function or abilities, or things are just changing, and there isn't a a supportive reasoning as to why, because traditionally in the biomedical traditional sense, it's very rare for folks to be tying in all of these other prongs to our health, right? So
Right.
I think it's just worthwhile mentioning that, again, we have to, when we're addressing pain or any other chronic illness, as you're mentioning, Jason, we have to look at it with a wide lens, and not just this narrow myopic view of, okay, this symptom, this fix, that symptom,
Right.
this fix. It doesn't work that way, because all of our systems in our body are working together, communicating together, and there's this interplay, as you said, Jason. So, you know, definitely considering that, again, this whole person approach to every to our health in general is going to be very important. So I'm so glad that we're having this conversation. So that being said, I want to segue into talking more about pelvic pain and foods that fight pelvic pain or help to support. And we're just talking about that, but I want to dive deeper into that concept of food as medicine, and foods that contribute to or don't contribute to inflammation,
Sure.
pain, etc.
Yeah. So I first like to start sort of talking about sort of an approach to food. So I think that before, and with a lot of patients, I do introduce the concept of mindful eating. Some folks are into it. Some folks like, I don't know. But usually when I share the idea with them, they're like, oh, yeah, I can actually have a relationship with food that is not based on this like value judgment system of like bad or good. So a lot of times we start there, or at least I try to introduce that concept and sort of gently reapproach it as time goes on, because I think we can talk about foods that are helpful or maybe not so helpful, but we really have to establish a good relationship with our food first. And mindful eating is just one way to do it, but it's one of the ones I like the most. So I have to put the caveat out there that, is there research that supports like mindful eating specifically with pain? There isn't. But this is a situation where maybe we've talked about this before, but it's like there's enough like sort of out there. For one, it's there's no way it's going to hurt you. I mean, there's zero risk. But there is good evidence about mindfulness and pain reduction.
Mm-hmm.
And so any opportunity we get to sort of meld those things together, like I'm sure, if researchers out there are listening to me, like we need to do this research. So somebody needs a mindful eating protocol for pain. Like, I don't know if I'll dip my toes in the water or not, but they've done it with diabetes, depression, binge eating disorder, a number of other conditions. It makes perfect sense that mindful eating would have an application in patients with chronic pelvic pain. And another thing that makes me think that too, and maybe you have experience with this as well, is the distress that we hear around the eating experience. So patients will tell you things like, well, I'm just so afraid to eat. And when I hear that, I know like, hey, we need to do some work around that first. Because there may be a lot of fear around, like, if I eat this thing, is it going to trigger my pain? Or if I don't eat this thing, is that going to help with my pain? And an idea of like, I have to be perfect around this or else,
Mm-hmm. I'm glad you're bringing that up, because I just wanted to chime in about from the pelvic floor perspective. We're working with folks too that have pain with defecation or pooping, pain in and around the anus, or after defecation, or even just with anal play, if that's your thing. Those are all pertinent to, do I want, like, eating? Because when you're eating, you're going to be pooping. And if there's an associated trigger that increases the pain dial with a physiological function like defecation, then the tendency to want to eat and your appetite around eating is going to be changed.
Yeah. And the same with beverages. I've had patients tell me like, I know I'm dehydrated, but I'm afraid to drink too much, because then if I drink, then I'm going to have to pee. And if I'm uncomfortable when I'm peeing, and it sets up this cycle, right? So chronic dehydration, of course, that's going to drive, pain. So then, we end up in a bit of a cycle.
Mm-hmm. Absolutely. Absolutely. So it didn't mean to kind
Oh no,
of
that's
disrupt your flow. But I just wanted to add like how, it is all connected, and that we need to be mindful of the behaviors and the patterns that we may find ourselves in when we're in pain, and they are habitually protective responses. Initially it might be helpful, but as time goes on, it becomes maladaptive
right.
and very detrimental to your health and your progress to recover from pain. So yeah.
Yeah, I think that's super important to note. And I think we've even talked about like on the other end of the spectrum, mindful pooping. It's like, can you be mindful
Yes,
going in and coming out? Like, reduce any opportunity, I think, to reduce,
absolutely.
turn down the dial of
Hmm.
pain and anxiety. Yeah, with mindful eating, what appeals to me about that, again, I'm a very like, let's get away from diet culture. I don't like that. I mean, it's included in my title, so it's hard not to use that word, right? But trying to get away from that culture, and I've seen it. Some prominent folks in the mindful eating community talk about the cycle of eat, repent, repeat.
Mm.
So we make a decision to eat something, then we feel guilty, like we must repent for our sin,
Mm.
and then that cycle sort of repeats itself where, if we can kind of get ourselves out of that cycle of feeling so much guilt and shame around the experience of eating, kind of what I will tell patients, and we'll get to, yeah, of course there are things we want to eat more of and eat less of. Like we'll get to that, but it's also letting them know like, hey, when you've committed to eating the thing, let's now just eat the thing, right? Like whatever that is, let's eat it, enjoy it, let go of judgment, because at this point it's going in your body. There's nothing we can
Right.
do about it. But also the thing that's cool about mindful eating is that it's not just this crunchy like outer space like like, because it sounds like it's got a sort of metaphysical component to it, and if that's your thing, cool. But it's also got a science. It's like it works because it's reducing cortisol in the body. It's allowing time for those hormones to get to your brain that says, hey, I'm full. So it's about checking in with yourself, like, hey, am I full now? How often do we even pause to ask ourselves the question? um,
Hmm.
you
Or
know
am
I,
I really hungry? Or am I just eating out of boredom, or because it's a stress response because I'm in pain or not in pain? And you mentioned enjoying it and having a sense of pleasure from it, being present with that experience of eating. And so often in our world today, we're very busy, we're distracted, we're often eating in front of a screen, and that is just, we're in this upregulated nervous system state a lot, and it's very rare that we have those moments to have that downtime and to actually take a couple of breaths, which with pain, I'm always telling folks to let's slow down, let's find the ingredients for your recipe for a low pain day, right? What's your recipe for a high pain day? And work to be able to recognize, hey, when I slow down, whether that's with eating or with movement or with touch or with sexual activity or whatever it is that that person wants to get back to doing in a pain-free state, we kind of have to do those things, but we have to find ways to do them that are enjoyable, as you said, Jason, pleasurable. And that is part of sensory integration. And folks have heard me name that before, but sensory integration is just using all of your senses, right? Not just
Mhm.
touch, not just movement or what you see. It's what you see, what you hear, what you smell, and what you taste. And all of those experiences within that sensory landscape or that terrain has the power to influence your pain dial.
Yeah, I love the food metaphor with the recipe. Obviously, you're speaking my love language, but two, eating is like a total sensory experience. If you think about, you know, it's not just taste, right? I love to use the example of like a clementine or tangerine or orange because it's one of my favorite fruit, like anything in the citrus family. But you think about like it starts with seeing it, right? And we have this, like, you can imagine, like, okay, I see this, and then that orange color almost tells me what I'm about to experience. And it speaks its own language. And there's texture, the rough texture of the orange. And then as you peel it, you get that sort of spray of like that citrus, you're like, I'm about to have this really yummy thing, And so, yeah, and so you smell it. And that's before you even put it in your mouth, right? Like, we haven't even got there, and you're already using, the sound too, like of the orange being peeled. And then when you put it in your mouth, you're still feeling it. Then you begin to taste it, and then still smelling, because it kind of goes back into your nasal passages. And like, yeah, I mean, all of it is a total sensory experience.
Yes. And I have to just give credit to Dr. Rachel Zoffness, who's a pain psychologist in California, for the recipe pain ingredient metaphor. So credit where credit is due. So thank you, Dr. Zoffness, for that. But I love that is an activity here that I want folks to try, because when you're so engaged and you intentionally shift your focus away from the painful parts, you are training your brain, your nervous system to dial that pain volume down. So not only are you mindfully eating, you're also reorganizing your nervous system, creating new pathways to help your brain shift attention away from the painful parts that hurt. Because with pain, and pain that persists over time, that becomes chronic and persistent, your brain is going to get really familiar with paying attention to those parts. And it's like a magnifying glass. And the more that you attune to that sensation, the more we pay attention, the more that we change our behavior, and the more that the thoughts and beliefs around our pain get bigger and louder, the sensation, the pain volume is going to go up. So this actual activity that you're describing to us, Jason, is such a wonderful activity to practice presence, mindfulness, sensory integration, creating a healthy relationship with food, and really, again, a helpful practice to literally turn down, reorganize your nervous system, to down regulate, to help turn that volume dial down. And so again, those are activities that are so complementary to how we work with persistent pain, and how we help move folks forward to getting back to doing the things they love, and introduce, you're going to be eating something you do every day, just like brushing your teeth, I hope. But you can use those moments. You don't have to add more to your plate, so to speak. You can actually just shift your perspective, shift the intention of the activity that you're already doing to become an exercise, to become a training opportunity.
Yeah, I love that. And what I was thinking when you were saying that is, this is food as medicine before we've even changed anything about what you're eating. Like, that's the cool thing about it. And of course, then we can start to make adjustments, and there are definitely things we might want to think about. But one of the things that strikes me about this, and I've already had a few patients kind of commit to this practice of just, hey, let's check in with ourselves when we eat. How do I feel? Like, even just checking in with yourself about what emotional processes are happening, what's my mood like, what's my sensory experience like. I've seen patients change their diet just doing this, because when we start to check in with how we feel about this sensory experience, our emotions, all that stuff when we're eating, we actually start to make different choices. And you said this beautifully earlier. And if I had a dime for every patient who said, Jason, I know everything I'm supposed to be eating, I'm just not doing it. Like, literally, the moment I hear that, I go, because nothing, and I'll get into some of the specific foods too, but I don't think any of it's going to be earth shattering. Like, a lot of it's stuff that we kind of know, but we need help putting it into practice. And one of the things we need help with, I think the most, is changing that relationship with food. It's like making better decisions. And something else you said too about making it a practice, or training, I think is the word that you used, is that it is like that. I think just like with meditation, And I'm still a novice with that. I will be the first person to tell you, I sit down to meditate and go, am I doing this right? Am I doing this right? You know, but that's part of the practice, right? But that once you begin to have those moments of clarity or whatever, you know, with the thing that you achieve there, you can start to bring that into your day-to-day experiences. So I think of, you know, because you're not going to eat mindfully at every single meal. Let's face it. Like it's just not like,
thank you for naming that.
Yes. I would love to tell you, you're going to sit down to your Thanksgiving dinner and be like, oh, I'm going to mindfully eat these mashed potatoes. It's not happening. It's not happening.
Right.
But what might happen is that if you've had enough experience sort of training the practice of it, you might start to go, you know, I'm good. You know, I've had what I want of this and I can now stop. So that's the goal. And you know, not everybody's going to achieve that. And I do also want to point out that some people do have, you know, there are hormonal situations that can drive changes in our appetite and satiety signals. And that's where a good registered dietitian and a healthcare team who can kind of look at things like, let's say, for example, sleep apnea can completely disrupt all of these cycles. And, you know, we tend to look at this, getting off into another subject, but it's a good example. We tend to point the finger at folks with sleep apnea and say, well, oh, you have sleep apnea because you're overweight. But there's evidence to suggest that you're actually maybe overweight because you have sleep apnea. And that's changing this hormonal system that you have going on, driving hunger signals when we really shouldn't be having them. So, you know, and vice versa. So just as an example of, you know, a whole person approach.
Oh, absolutely. And how important we know sleep is for pain modulation or turning down that dial. Like there's so much literature to support and back up how important sleep is for decreasing pain and improving function. So sleep is very important. And I'm so thankful that you named like, hey, it's not how much you weigh that's impacting your sleep, right? It can be what kind of nutrition and what's going on underneath that is impacting your weight, or like you said, satiability and desire to eat and hunger and etc. So yeah, let's not point the finger. It's so easy to just try to point the finger at one thing, but we don't live in a vacuum, folks. It's impossible to
I mean,
do that.
That could be a whole topic for an entirely different podcast. It's like talking about diet culture and weight shaming and all those things that happen that make it just makes our job harder. It doesn't work. You know, pointing the finger at people and saying, well, it's your fault, you know, that you live in this food environment that is super saturated with all of these, like, you know, easy, you know, a lot of times, you know, we're in an inhospitable environment to make the best choices, and something has to be said about that. You know, which kind of leads us to, okay, so what can we do? Like what different decisions can we make to help us with chronic pain?
You read my mind. It's a wonderful segue, Jason. Can you tell we work really well together? Like we are on the same parallel universe here. So yes, let's talk about, you know, food does matter, and what we put in our mouth, you know, does matter. And it is food as medicine, as we've been talking this whole time about. So, you know, specifically for pain and just for an overall healthy, optimal just body, right? And we can go into what does, you know, health look like for folks, and that's going to be individual. As we've already said, you know, what's healthy for one person might not be the same for another person, and we're working within an individualized approach. But generically speaking, I mean, we do need you know, nutrients and other things to keep our bodies functioning optimally. So what are those things? Let's talk about those important factors as far as our nutrition goes.
Sure. Yeah. So I think you kind of touched on that too. Like the key pillars of good nutrition are balance, variety, and moderation. So what it really means, and variety is so important, and we're learning more, and we can talk a little bit about this too, about the gut microbiome and how we sort of keep a healthy and happy gut really means like eating a varied diet, but particularly, you know, we're not talking about different colors of Skittles here. We're talking about, you know, wide variety of, and you know, again, everything in moderation. And if you're going to eat them mindfully and enjoy them. But you know, fruits and vegetables, plant foods. I mean, if I could say, and in fact, I would just put that at the very top. Like, let's just start with like the most important thing you can do, whoever you are, whatever condition you're looking to improve, whether it's pain or anything else, eat more fruits and vegetables. period. Like if you just do that one thing, that will transform your health. Just that one thing. And it's so simple in theory, right? This is where that sort of like, okay, let's practice some skills to get these things in our diet more. But sometimes as the right solution is a simple one. It's like, let's eat more plant foods, and particularly more fresh fruits and vegetables. And when I say that, I cook them, that's fine too. But, but really focusing on that. There are so many compounds in fruits and vegetables that help our body reduce inflammation, that help to fight pain, that help to fight some of those inflammatory chemicals that our body may be producing. There are more things in fruits and vegetables that I could possibly name. And the other thing is we're still learning about these things, right? I mean, we're still finding new compounds in fruits and vegetables that we're going, oh, hey, this one thing in this food might actually help with this particular health condition. Now, as a caveat to that, what I always want to say is also your strategy to getting fruits and vegetables is, wait for it, eat them.
Oh, eat them. Right.
Eat them, because the tendency is we always look for there's got to be a shortcut, right? Like, is there some, and I get this question a lot from patients, like, there's got to be some like magic powder, some pills, some juice, some like
celery juice.
Yeah. Oh, oh boy. Again, is celery juice healthy? Sure. But is that going to cure everything? No. And we should, it should be pretty common sense to us to go like, hey, anytime somebody's promising a quick fix, or like it's just this one, the thing I hear a lot in the world of nutrition is the promise of magic. It's just like, well, did you know it's just this one thing you haven't been doing that will cure everything? It's like, you don't say. Because we've heard this story a lot over the years. I've been at this for over a decade now, and these things keep sort of, and they're like zombies that won't die. I fully expect some of these diets that are like ancient dinosaurs I'm not even going to speak them, because if I do, I will speak them to life. That they will resurrect, and then someone will go, oh, we all should be doing this now.
Oh, it's the physical therapy world too. I just have to say that, like with taping and trigger point stuff, and here's the next magic exercise, and here's the dry needling. I mean, again, like, yeah, I hear you. That's
again, like I said, I even try not to speak the names, because it's like, if I do, your comment section is going to fill up with people going, no,
Yeah,
like, I've been doing this diet for X many years, and we can get into some of that too. But really, nobody's going to, I think the beautiful thing about eating more fruits and vegetables is that no one can argue. The science is so clear. Like in the world of nutrition, there's still a lot of muddiness. It's a newer science. There's a lot of poor quality research out there, but that's not even a question. Like, more fruits and vegetables are going to help you. And let's figure out how to get more of them in your diet. Let's start there and just build on that. And sometimes what I think it takes is not taking my word for it. Like, so I've shared this bit of advice for you, is that when patients ask me for a diet plan, like, hey, will you give me a menu? What I tell them is, sure, I can give you a menu. Guess whose menu that is? It's mine. Right. It's the foods I think are good, not the ones you're going to want to eat. And at some point in time, you're going to go, I don't really want to have asparagus, So sometimes it's helpful. Like, let's just sit down and go through, like, make a list of all the fruits and vegetables you enjoy eating. And then maybe the ones like, hey, I tolerate these. And then a list of like, yeah, I'm never going to eat these. Because let's be real. If I have those too. I mean, they're just things that I kind of go, nope. Yeah. And that's okay. Like, if you don't love okra, don't eat okra.
Right.
Like,
right. I agree.
Or, so I think, starting there, and again, I don't want to spend our whole time talking about that, but it's so important in a wide variety of them. So kind of misconceptions too, is like, some people will just find like, okay, I ate a banana, so I'm good. It's like, okay, well, what else did you have? Like, how can we expand the menu of different, like, that's a great place to start. And I don't want to knock them. Bananas are wonderful. But let's kind of expand our variety. So then kind of looking at other strategies overall. So I think this is where, your expertise really comes into play too. And what I've been learning from you is like, hey, let's also kind of figure out what are the driving factors of this pain, because that may sometimes drive what we want to do with diet. So is it inflammation? Then we might want to look at an anti-inflammatory pattern of eating. Is digestion and that sort of crosstalk that's happening, is that driving this? And maybe we want to look at, what foods might we want to shake up to help your digestion out. So, but I think overall, like an anti-inflammatory eating pattern, again, not going to hurt anybody. And really what I think of is like a Mediterranean style of eating. So plenty of plant foods, fiber is your friend, healthy oils like extra virgin olive oil, encouraging, and I'm going to say this, and if you get, if you get comments, then so be it, but whole grains, like I'm just going to put it out there.
Yes, for whole grains.
Yeah. It's like, yeah, come on, so, and a wider variety of them too. But, there is a fear right now. There's this, we're in a very carb fearing state as a society right now. And I just want to put out there that in fact, I'm going to do something pretty wild.
Do it. I
will quote.
This is the show to do it.
Yeah, I'm going to quote a drag queen. The great calorie Kardashian said, "Carbs are friends and food." Carbs are your friend. And I love that when I heard that. I'm a big Drag Race fan. When I heard that, I was like, yes.
Absolutely.
Look at population studies, because I think, folks are going to argue like, oh, everyone should be doing, low carb diets. Like, you look at pockets where we have longevity, those folks are eating carbohydrates, people. You look at blue zones, where people have, the longest longevity on the planet. They're eating carbohydrates. It's not carbs that are the enemy. It's what we do to them. So it's how we process them and then refine them, and then what we have them with. So when we take a grain like wheat, barley, oats, whatever you want to spelt, there's a wide variety of them out there. But when we turn that into a refined grain and we add a bunch of sugar and saturated fat to it, that's going to negatively impact our health over time, right? We've taken something that actually has some pain fighting compounds in there, that have antioxidants in them, that have gut-friendly fiber in them. When we strip all that away and we take it down to just, the starchy goodness that remains, then we have a food that may be problematic in excess. So I guess to summarize that is eat more whole grains and limit refined grains and sugar. And again, all things in moderation. This is where good, some mindful eating strategies can help, because what I always tell patients is it's not that I'm saying eat no sugar, because I think that's quite impossible. It's really tough. It's really tough. It's more like, hey, maybe pick the thing you really want to eat and really savor and enjoy that. And how can we learn how to do that? Like, I have patients who can stop, like, and say like, yeah, I have a square of dark chocolate and I really, really enjoy that. And I'm good,
Right.
Right. And sometimes, I'm going to have the piece of birthday cake. It's going to happen. It's also about what else are you doing? What does the overall pattern look like? Exactly.
So all of our prongs to our lifestyle, where we are at in our life, mood, as you said, mood, we're paying attention to all of these ingredients and menu items that, again, contribute to a high pain day recipe or a low pain day recipe. And it's the awareness, slowing down and being mindful, that will allow you to start to recognize these patterns, because it isn't just random that you have, ups and downs. It's not random. It may seem like that for sure. But if we take the time to slow down, to be present, to be aware, and to create some space within our experiences, right? Start to basically lessen our identity and enmeshment with pain or food or what have you, and just be present for the experience without being judgmental or negative to ourselves or what have you. It's a completely different mindset and approach, and also allows you to really get more clarity on your own situation. And what ingredients are going to work best for you, and also being flexible with those ingredients, right, Jason? Sometimes you want to add a little bit extra spice.
You got it.
Right? Maybe a pinch of more salt, add an extra vegetable in there or so. So, you have a baseline recipe, but then once you kind of get really comfortable with that recipe, right? I like to cook. My husband would beg to differ, but I like to cook. And once I get really used to like, oh, I know the ingredients now, I can actually play with it a little bit more. I can change it up or mix it up. And then I become a master with that particular recipe, right? Because I'm not afraid to steer away from that protocol recipe. I'm now really fluid with that process. So you will get there, but you got to start somewhere, right? We all got to start somewhere.
Yeah. And I think, we talk about this too, this idea of like, experiment. Sometimes we do kind of have to be willing to play with things and saying like, hey, maybe I need to take this particular thing out of my eating plan for a while and see what happens. Because maybe this isn't playing well with my particular body chemistry and my particular situation. And that's where I think a good, this is something, it's like, don't try this at home, kids. Like this is where I think a registered dietitian nutritionist can really be a helpful partner in helping you look at the pattern and going, hey, I'm noticing this comes up a lot on these days when you have, the more pain. And maybe we need to look at maybe taking this out or replacing it. I would say replace, don't take away. Maybe there's something we could substitute this with that might allow us to see. And maybe we find out this isn't bothering you. This, we did a little experiment. We took something out of your day's eating plan and nothing happened. So, that's probably not a problem for you. So, and that happens too, so we have to be willing to experiment. So something, when we talk about digestion, something I might work with some patients. And again, this is really a job for a dietitian, would be like low FODMAPs. That may be appropriate for some patients, especially with digestion, especially if they've been labeled IBS. That may be something we look at, but it is restrictive. And these types of things are not meant to be like a long-term thing. They're meant to be let's see what works and doesn't. And then once we know, a lot of times it's also like, the dose makes I don't want to say poison, but it's dose dependent. So let's say, for example, we find, I'm just going to use this as an example, and I'm not at all saying this is a bad food or a no food for no.
Hey, Jason, sorry, don't mean to interrupt, but I could you clarify for our listeners and viewers what low FODMAP means, just in case folks don't know what that means?
Sure. So FODMAPs are fermentable carbohydrates. I believe it's fermentable oligosaccharides, disaccharides, polysaccharides, and polysaccharides and polyols. I think that's correct.
It's a mouthful.
It is a mouthful. And I may have missed one of the letters of the acronym, but essentially at the heart of that, these are carbohydrates that get fermented within the gut and can produce symptoms of gas and bloating. And for some people that makes them more uncomfortable. And for whatever reason, these are normal processes. We all make gas. Like, it is totally normal. It is a part of life. Let's embrace it. But we know that some people are actually more sensitive to the distension that happens when and they may have more gas and bloating than others do. And so, and specific components in these carbohydrates may be more problematic for some people than others. So you kind of go through the alphabet and you pull out specific, offending foods. And then what happens is you find you can actually tolerate them, but only in certain amounts. So it's never about completely eliminating these foods. That's not our goal. That's rarely my goal for anyone, unless there's an absolute medical necessity, like an allergy. Celiac disease would be another good example of something we have to pull then gluten out of the diet forever. But even with a low FODMAPs eating plan, it's not forever. And what we're really trying to do is find the triggers, then pull those things down, not out, down to a tolerable level. And then again, like you said, sometimes it's just knowledge is power, right? Like when you figure out what those foods are, then like, hey, I'm going to make a decision to have a whole cup of this. And I know it's not going to be good for me, but I really want it, So sometimes you make those decisions.
Exactly. And that's the same thing for activity. So kind of bringing that back to pain, right? And with food. So if you know that a certain food, gives you a little bit more bloat and gas, and that tends to, visceral sensitization and that distension, that can activate alarm bells. in our body and increase the dial, but that doesn't mean that you're in danger, that you're injuring or harming yourself. It just means that the sensitivity dial is going to go up, just like, the smoke detector goes off if you burn popcorn in your, in your house, or burnt toast, right? It's meant to be
Right.
sensitive, but it doesn't mean that the house is burning down, right? And so we want to respect that system, because it's such a beautiful system to protect us. We wouldn't be here if we didn't have pain as a great protector. But sometimes it does get a little too protective, and all of what we're talking about is to help to lessen that sensitivity, to bring back tolerance to various types of tissue and body demands. So whether that's with food, again, with distension of organs, or activity, and activity, it's the same concept that we're talking about that so beautifully blends in with what you're speaking of diet nutrition, is that we will choose to do things that are more important for us, even though we know that it's going to ramp things up for us. But the beauty of that is that we have that choice, and we choose to participate in those activities and to eat those foods because it brings us pleasure and brings us joy, even though it can ramp up that sensitivity. But as you keep doing it too, I do believe that that dial does turn down incrementally as you continue to slowly kind of experiment with food, with activities, with touch. It really helps to desensitize or lower that sensitivity and that neural upregulation. And the body acclimates and adapts over time. It's kind of like a callus forming rather than a blister. Like,
Yes.
it's like friction, pressure. Sometimes I tell people, like, yeah, like that happens over time, and you're really not aware of it for the most part, because your body has enough time to adapt to the demands being placed on it. Versus a blister, it's the same process, but it's too fast, too soon, too quick. And then you have a blister, and then it hurts,
Right.
Think callus, not blister.
That's such a good analogy. I mean, I think, you could even say like lactose intolerance. A lot of people don't know. They imagine like lactose intolerance, well, they can't have any dairy at all. And it's like, actually, usually they can tolerate some. It's a limit. Like, it's once we exceed that threshold, and that's like the blister, right? Like,
right.
Like I can have like a half a cup of yogurt, but if I have a whole cup of milk, I gotta
Right.
go. Like, and it depends on what form. Like, yogurt doesn't actually have a lot of lactose in it because the bacteria have broken it down. But just as an example, it's dose dependent. Like, and it also depends on the pattern. It's like I can maybe tolerate a little bit of this, but not a lot of this. That's where I think, I guess, a good overall message too about nutrition is focus on the good. Because if you focus on the positive things you want to include in your diet to make you healthier, you're going to kind of nudge out other stuff. And you don't have to get into this cycle of like guilt and shame and all those negative feelings we can have, and kind of getting past that and really just saying, like, let's focus on how do I fill up my plate with the healthiest stuff possible. Let's just focus on that first. And there's a lot of different avenues we could take towards that. I think it starts with you. I think it's starting with finding out like what eating plan. I try to substitute the word eating plan for diet. It's a 4-letter word for some people. What eating plan sustains my health that I'm okay with. Like, I always, I'm a full-time educator, so when students ask me like, hey, what's the best diet? It's like, the best diet's the one you can follow.
Right. That's what I say about exercise. I love it. See, this is why this energy and this collaboration is just so powerful, because it's the same message I say for exercise. People say, well, what's the best thing I can do for my pet? What's the best exercise? What's the best stretch? And it's like the one that you're actually going to do.
Yes.
And the one that you're actually going to enjoy. Yeah. There really is not the one magic exercise or the one magic stretch or the one magic X. It doesn't exist. It's really about trying, being playful, feeling first, thinking later. Like, don't think too much about it. And humans, we tend to overcomplicate things. And I think you mentioned this earlier, Jason, we're like, it doesn't have to be that complicated, even though all these systems that we're talking about are very sophisticated and complex. The treatment and the approach doesn't have to be. That's the beauty about all of this. We do not have to be specific or hardcore with our protocol or structured. It's really about finding what your own flow, your own dynamic that you can work with, feel confident, feel safe, and feel comfortable.
Absolutely. And, I think just too, giving patients a template for like, what does this look like that isn't so specific, to, we talk about, so looking at a good example, and I share this with patients all the time as like, hey, if you want an overall, like rather than give you a menu, I love the Harvard Healthy Eating Plate. And maybe you can link out to this like in resources or
Definitely.
something, because I think it's a wonderful, just like, hey, this is sort of like the overall pattern that supports good health. That to me, I hope no one from the USDA is listening to this, but I'm just going to say that our history of developing these sort of like food guidance systems, like the old food pyramid, and then my pyramid, which was I'm just gonna say it was a mess, and then we evolved to my plate, which is still kind of a mess.
Appreciate you naming that, because it's the truth. Yeah,
it is. It's kind of a mess, and it's not always. If I were just to show that to a patient, they would just kind of go like, well, first of all, how big is that plate? Is it like this or is it like this? So we got to talk about like, okay, let's, get real with that. But also it's missing some things. And an activity I always do with my students is have them look at my plate and say like, what do you think about this? And we'll look at other countries. Like Belgium has a fantastic food pyramid. Like we could throw that out there too. I think theirs is wonderful. And really a lot more illustrative than our current sort of dietary guidance system is a little bit flawed. Water's not on there. Like that's the thing that always like drives me nuts. It's like,
oh my goodness,
put water next to the plate. Like,
that's a good point you bring up.
Oh yeah, and I have my own theories as to why it's not on there, but we can get into that another time. But it's an overall, again, it's an anti-inflammatory pattern of eating, sort of illustrated. It's a lot of plant foods, focusing on more plant proteins, less animal proteins, especially less red meat, healthy fats, especially like let's get some omega-3s in there, fatty cold water fish. If you eat fish, if you're following a vegan or vegetarian pattern, then in plant sources like canola oil, walnuts, ground flaxseed, and then micronutrients. I didn't even really touched on that, but some micronutrient deficiencies can also be driving pain. So we look at things like magnesium, maybe B12, especially if folks have been on proton pump inhibitors for a long time. Looking at vitamin D status. And these are all things too that I say, again, get some guidance. Don't just jump in there blind,
Right.
Sometimes supplements are almost sort of like, it's like an open drug cabinet. So the supplements can behave like medications. And so, you wouldn't just walk into a pharmacy and say, give me some of that and some of that and some of that. I mean, they wouldn't let you, for one thing.
Right.
But we kind of have that model with supplements right now. Where there's a lot of misinformation. It's poorly regulated. We could probably do a whole segment just on supplements.
We may have to.
Yeah, bring it. I'm down. Yeah. So maybe more to come. But again, I think it's just a good kind of disclaimer. Like, hey, do your research. There are resources out there. One that I really like, a couple actually. One, as a consumer, the current supplement market is buyer beware. What that means is, because there's so little oversight in the supplement industry, the onus is really on the consumer to protect themselves, which is never the best situation to be in, right? Because that relies on the consumer having access and knowledge that we may not have. So Consumer Labs is one place that patients can check. It is a subscription-based service, so I think you do have to pay to get access, but they do actually some quality testing on different supplements, and you can kind of see because the thing is, you can get stuff on the market that does not have what it says it has in it, does not, there's no guarantee it does what it says it does. There's no company that can guarantee that. But again, it's like you may go buy saw palmetto and it's actually sawdust.
Right. And that's the reality, folks. Yeah.
It is, so that's one place you can go. And another totally free resource is the National Institutes of Health has something called the Office of Dietary Supplements. And they actually it's the NIH ODS. You can just Google that, but you can search almost any ingredient and they have like a repository. Like if you're curious, like, hey, what's a safe dose of this? What does this actually work for this particular health condition? Spoiler alert, the answer is probably no. But you can go there and have the NIH tell you why it doesn't work.
Right.
I'm not totally anti-supplement. So to be clear, I do recommend them for patients when it's appropriate, but I probably do more taking folks off of stuff than putting them on stuff. So,
Agreed.
Anyway,
and so important when you're having like urinary urgency and frequency, bladder pain, and constipation and such. So, I'm always, and I know you and I are constantly looking at medication lists and supplement lists, and is this really kind of interacting with what's going on here as far as like drug nutrients and how they're feeling and such. So I wanted to quickly and I know there's probably going to be a whole conversation that we can have on this, a whole episode. And I'd like to talk about antibiotics because for chronic prostatitis, and I do that in air quotes, because that is an umbrella term that is used historically for pelvic pain in penis owners, it is also treated based on the diagnosis in the label, which means infection, inflammation of the prostate. But we know now through the literature that less than 5% of folks actually have an active bacterial infection. Not to say that bacterial prostatitis or chronic bacterial prostatitis isn't a thing, because that certainly can be the case, but it's rare, so 95-97% of cases are just pelvic pain, plain old pelvic pain, and it may not have a direct connection or correlation to a specific thing that kind of started it. It might be immune mediated, it might be an injury, it might be, who knows, right? So we don't have that information now, but we do know it's multifactorial in nature, and it does require a multimodal approach for treatment and for recovery. So on that tangent, circling back, antibiotics are the first line of treatment, really, when people go to get help for pelvic pain / chronic prostatitis, in air quotes here. They're given antibiotics, but not just one round of antibiotics. It's like another and another and another, despite negative tests, despite negative lab work. They're still given antibiotics because that, if I have a hammer, everything looks like a nail, right? So let's talk about that a little bit here for a few minutes, about the impact that antibiotics have, or persistent use of antibiotics, right? They're great, but they shouldn't be abused, and how that impacts gut microbiome, digestion, and pain.
Yes. I'm so glad you brought that up, because it is, as you and I know, like, you're lucky if you've gone through this journey and you've only had one round of antibiotics, because many men get multiple rounds. And I think the answer to the question is probably the scariest answer. What's the result of this? We don't know. We can speculate. And I think the what we can speculate based on what we've seen in the literature is that constantly wiping out your healthy gut flora. I mean, we know some consequences. So let me give one example is C. diff, Clostridium difficile, is an infection that you can get as a result of being overtreated with antibiotics and wiping out the healthy flora. And sometimes with these broad spectrum antibiotics, maybe we leave behind one or two kind of particularly nasty bugs, and then those kind of take over and populate the gut. So that's just one potentially negative consequence. Not maybe as, you see that more in the healthcare setting, but I've seen it among, ambulatory, healthy, walking, adults who've been given antibiotics. I had it actually as a teen, which is like a wild story. Like at the time, I was given antibiotics for acne and actually got it. And likely the doctor thought I picked it up in a nursing home where my grandfather was. But the gastroenterologist was like, we've never seen this before, 19-year-old, 20-year-old, but now you're hearing it a lot more. And again, that's just one example, but we know that this sort of, the healthy population of microbes that live in our gut, we think sustains our health like much more profoundly than we ever knew before. And we're now seeing these connections to our mental health, even very likely to pain. And there is some research that's starting to support that. And then, we've talked too about sort of the gut-brain axis and this idea that they sort of, the conversation is not one way.
Right.
And the microbes that live in our gut are part of that conversation and a part of our overall health. Mm-hmm. So I feel like I've gone into in a circle with this, meaning to say that, the consequences of this could potentially be quite profound and really poorly understood right now. That what are we doing when we consistently wipe out the colonies of healthy bacteria that live in our gut? And then what are we repopulating them with? So I think supporting gut health, and there's, again, a lot of the things we've talked about today support repopulating your gut with healthy bacteria. It's not just a matter of probiotics. So we can talk about that too. There's a lot of questions about probiotics even still. That's still such a new area of research. But really, I think with nutrition, prebiotics, these are the things that feed healthy gut bacteria. So my analogy, hopefully this will work, is that it's like a party. Like in your gut, it's like a party, right? And if we want to have a great party, we got to have good food, right? And what kind of food I serve maybe says what kind of party I have and what kind of guests show up at that party. So, a bucket of KFC is very different than, a vegetable platter, right? Like what kind of guests do we have at this party? That's kind of the thing. The food that you eat sort of invites a different population of bacteria, different species of bacteria into your gut. Mm-hmm. And we can influence that actually pretty quickly, one way or the other, depending on the choices that we make. And really, this is another opportunity for me to plug fiber, because I think fiber is our friend. With the caveat that, if you're having digestive problems, let's talk to a dietitian and figure out hey, what kind of fiber is right for me? It's not going to aggravate this situation. But assuming you don't have issues like that, we are chronically fiber deficient in the United States. And we know that has got consequences to our health. And I think what we're learning is one of those, some of the drivers of those consequences may actually be related to the gut microbiome. That it's not, because we used to kind of think, fiber is just really about, preventing chronic constipation and diverticular disease and these kinds of things. And now I think we're realizing it's actually really about feeding these healthy gut bacteria, and that sort of having an overall systemic effect on our health. So
and I was just gonna say, this is all yummy stuff. It's so important and overlooked, not really talked about. And if it is, it's really done in a just misinformed way. And that just causes for more confusion and frustration, and really it taps into our financial resources, especially for doing supplements and being on particular diets and things like that. And I just think it's important, what we're talking about is so important to give folks hope, but in a pretty logical, simplistic way, and not overcomplicating things as far as nutrition and diet goes, and also hopefully not creating more of a safety or a safe space around talking about diet and nutrition. And really, I think you've really modeled what an awesome registered dietitian nutritionist is, and working with one to complement their health and well-being. So thank you so much for doing that with us today, and also for sharing all of your wisdom. I mean, you are amazing. All of my patients rave about you. I just have to say that. I'm going to plug it because they do. And it's been such a wonderful complementary collaboration for folks to have. So, thank you again for shining this wisdom and for being on the show today. Are there any last minute or just burning points of wisdom that you wanted to share before we bring closure to our segment today?
Yeah, I guess what I would say too, just to echo what you say, it's a joy working with you and with your patients too. I think there's such an opportunity. Nutrition can be a source of empowerment. It's something we can do for ourselves, that we all have to eat. we do to live. So, making these lifestyle changes doesn't have to be some like icky thing that we have to like, like it can really be a true source of joy and empowerment and a way to positively influence your health. And honestly, it's just been my pleasure to help patients on this journey.
Thank you. Thank you so much. And to all of our listeners and viewers out there, thank you so much for being here with us. This is Dr. Susie G in Loving Wellness for Your Pelvis and Gut. This is Dr. Susie G signing off. Until next time, my friends.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.